When I'm asked how long I'm gonna be here, it seems like a very justified question. You realize how important you are when your patients are asking you that. I think family medicine is not always the most sought after for their primary care docs. That's the person that they're gonna have a relationship with. That's the person that's gonna advocate for them. It is a lot of trust building, and it takes a long time.
Navajo Nation, it's our home, it's our land. It's 4 sacred mountains. Through war and through trauma, it's where the Navajos feel at peace or can walk in beauty, which is our spiritual way. She'eya Dr. Whitehair Yanashia, Ashkana Zo Nishlet Wudichin Bashichin, Tchashin Jashe Nakaridena Shanela.
Hello. Hi, doctor.
We have a national doctor shortage in Native health.
The reason for my visit today is my asthma's acting up.
And continuity is definitely an issue.
Okay.
Every time I saw a new patient, or even if I'd seen the patient a bunch of times, when are you leaving, or how long do you think you're gonna be here? And then once I had been here 6, 7 years, I had seen a bunch of other doctors come and go. And that was really hard, right? These were people that were my friends. And so I came to understand where my patients were coming from. There are about 50,000 patients that Northern Navajo Medical Center takes care of. There's approximately 70 physicians on the staff here. We also have a hogan outside. A traditional healer can do ceremonies for our patients there as well. The scope of care is just so broad. When somebody comes in with a problem, we can't just refer them to somebody else. So we take care of patients in the hospital, in the clinic. We have patients in the intensive care unit. We deliver babies. And then we try to bring our care out in the community too. And that's what I love about rural medicine. It's what is challenging for me, but it makes me feel like I'm doing the work I was trained to do.
So this happened last week, and I'm not...
One concern we hear a lot from our patients is that they get a different doctor every time they come, or they have a doctor that they like and then that person leaves and they feel more disconnected from their care. I'll call you when I get the results back, but then either way, I'd like to see you back in about 3 months.
The lack of continuity is a giant problem.
So I just saw a 65-year-old gentleman, history of migraines, and just came in today.
So we're going to make doctors for tribal communities.
One of the things that predicts where a doctor is going to practice is where they did their residency training. So we started the program here to grow our own and to produce doctors who are comfortable taking care of rural communities.
Hey Robert, how's it going?
Good.
Dr. Couldridge, Marcus.
Marcus Couldridge?
Yeah. I've been here for about 5 months now. My patients in my clinic didn't have primary care doctors.
Yeah, I try not to take medicine for it, just the Tylenol.
I've started to be able to have the 3rd or 4th visit, getting into their story and figuring out how you can best treat them based on that.
So this is something that will help the hospital staff to think about their patients, you guys, the community. What do you think about when you go to the clinic?
The residents also go and learn from the community to help decide how they want doctors to be trained.
I think a suggestion I would have is, when you have triage, when you walk in, Res Cafe is a way for us to bring the community together, share food, and share an open discussion on different health topics. What did you write on yours? This one? Hire more doctors?
What stands out for you? What words?
We always need to be trying to earn the trust of our patients.
So what do you guys think? What are some things that would make it better?
There are times when the patients don't trust us and don't trust the system.
I don't go to the hospital. Not unless if I have to, then I go.
How come you think you don't want to go?
People seeing you out in the community, not just seeing you in the doctor's office, I think is really helpful for building trust too.
That's kind of good suggestions for some of these things.
I feel that I'm bringing someone to my family. In the Navajo way, everyone is our extended family. I have to bring someone good.
We've merged two communities together. The doctors are very knowledgeable in what they do, but now they're learning what our community is about, what the Navajo traditions are, what the culture is. Being part of that gains the trust of the community.
Trust works both ways. You don't build that trust unless you are honest with your doctor. And then the doctor has to be able to convey to you the best thing we need to do. If you don't have any trust, you're going to be reluctant. You might just ignore your health problems.
The residents, when they got here, I think they were a little startled by the complexity of all of the patients that they were taking care of. The medical complexity, and then the social complexity of things that they had to address.
So just quickly, your available budget as of October is $16,328.
So remember that $10,000 is for the basketball court.
As a community, we do know the challenges that we have to overcome. Poverty, substance abuse, not having access to secondary education, hospitals, you're traveling 2 hours round trip.
There's no good food here. There's like 12 grocery stores on the Navajo reservation, which is the size of West Virginia, so this is a food desert. But I get to see it on the other end: diabetes, heart failure, premature death, all of these things that are just hurting my tribe.
It's really important to me, and I tell my patients this all of the time, that they get care that is just as good or better than anywhere else in the country. They should not feel like this is just rural medicine and we're doing the best we can.
It's just a blessing that, I have the doctors I have the medical care that I have, and I have a hospital that's close by.
Rural medicine, you don't ever have a day that's like the day before. Being here, learning as much as I can, having complex patients, having complex social situations, I'm getting excellent training. And I really love these open spaces.
We live in a very beautiful place. We have our culture, tradition, ceremony. We're still able to hear families speaking our Navajo language. Their goal is to make them fall in love, but something that I worry about is how do we keep them?
A resident leaving every 2 years is hard. It's not the best solution, but we are trying to select people who will either stay here at this hospital or stay on the Navajo reservation.
Personally, I am getting more and more attached to my patients and the hospital and my supervisors and my clinic staff, and I don't want to acknowledge that it is only going to be temporary.
My hope for our Navajo people is to have the level of health care that they deserve, and I think it's headed in the right direction.
It's a trick to leave. I don't know what I don't know how you leave these people. I don't know how you leave this community.